lot of people want intact parts these days because they're looking for specific nodes. AB nodes, SA. I was like, wow, I didn't even know. Good for them. Yesterday was the first time she said people wanted lungs. And then, like I said, always as many intact livers as possible. People just want
livers.
People want lower extremities too, which that's simple. I mean, that's easy. I don't know what they're doing with it. I guess they want muscle.
Yeah, a dime a dozen.
Every provider has had patients who want to donate their tissue, and they absolutely want to accommodate them. They just want to do it in a way that is not perceived as this clinic is selling tissue, this clinic is making money off of this.
Okay, so when you are or the affiliate is determining what that is monetary.
Yes.
So that it doesn't raise any question of this is what it's about. This is the main. What price range would you?
You know, I'm going to throw a number out. I would say it's probably anywhere from $30 to $100, depending on the facility and what's involved.
The $30 to $100 price, that's per specimen that we're talking about, right? Yeah.
Yes.
How much of a difference can that actually make if you know what's expected or what we need versus?
It makes a huge difference. I'd say a lot of people want liver, and for that reason, most providers will do this case under ultrasound guidance, so they'll know where they're putting their forceps. And a rate-limiting step of the procedure is calvarium. Calvarium, the head is basically the biggest part. Most of the other stuff can come out intact.
Right.
It's very rare to have a patient that doesn't have enough dilation to evacuate all the other
to bring the body cavity out intact and all that.
So then you're just kind of cognizant of where you put your graspers. You try to intentionally go above and below the thorax so that, we've been very good at getting hard, long liver because we know that, so I'm not going to crush that part. I'm going to basically crush below, I'm going to crush above, and I'm going to see that get out intact. And with the calvarium, in general, some people will actually try to change the presentation so that's not vertex, because when it's a vertex presentation, you never have enough dilation at the beginning of the case unless you have a real huge amount of dilation to deliver an intact calvarium. So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate an intact calvarium at the end. So I mean, there are certainly steps that can be taken.
So they can convert to breech, for example, at the start of the.
Exactly. Under ultrasound guidance, they can just change the presentation.
What would you expect for intact tissue? What sort of compensation? What sort of?
Well, why don't you start by telling me what you're used to paying?
Okay, I don't think so. I would like to know what would make you happy. What would work for you?
Well, in negotiations, the person who throws out the figure first is at a loss, right? So.
No, I don't look at it that way. I know you want to play that game. I get it, but no, I want
lowball because I'm used to low things. Okay.
What I want to know is what would work for you. Don't lowball it.
Okay.
Tell me what you
really. $75 a specimen.
Oh, that's way too low. That's way too low. I want to keep you
50,
happy.
I've been at places that did 50 too. But see, we're not in it for the money position of being accused of selling tissue and stuff like that. On the other hand, there are costs associated with the use of our space and all that kind of stuff. So what would you think about it?
Right. So way higher than that. So I'd like to start at around 100.
Okay. Now this is for tissue that you actually take, not just the tissue that person volunteers that you can't find anything. Right?
Exactly. What we can use, what is intact. So that's why I'm saying no, don't lowball. I want you to be happy.
It's complicated by the fact that our volume is so low too. I mean, are you looking at 8 and 9 week specimens or only second trimester specimens?
10 to 12 week, end of the first trimester. If those are pretty intact specimens, then that's something we can work with.
So that's an interesting concept. Let me explain to you a little bit of a problem, which may not be a big problem. if our usual technique is suction at 10 to 12 weeks, and we switch to using an iPass or something with less suction in order to increase the odds that will come out as an intact specimen, then we're kind of violating the protocol that says to the patient, we're not doing anything different in our care of you. And to me, that's a kind of a specious little argument, and I wouldn't object to asking Ian, who's our surgeon that does the cases, to use an iPass at that gestational age in order to increase the odds that he was going to get an intact specimen. But I do need to throw it out there as a concern, because the patient is signing something and we're signing something saying we're not changing anything in the way we're managing you just because we agreed to give tissue. I think, they're both totally appropriate techniques. There's no additional pain involved. I don't think the patients would care one iota. So I'm not making a fuss about that.
Okay. And are we agreed that $100 would keep you happy?
Well, let me agree to find out from other affiliates in California what they're getting. And if they're getting substantially more, then we can discuss it again.
Yes.
But the money is not the important thing.
No,
but it has to be big enough that it's
But
worthwhile
but
to
it
be
is something to
paid.
talk about. I mean,
Another thought is we can talk about specimen as per specimen per case or per procured tissue sample, which would be so that if we're able to get a liver thymus pair, maybe that is $75 per specimen, and so that's for for liver thymus pair, and that's $150, versus if we can get liver thymus, brain hemisphere, and all that, then and then so that protects us so that we're not paying for what we can't use things
It's
for.
been years since I've talked about compensation, so let me just figure out what others are getting, and if this is in the ballpark, then that's fine. If it's still low, then we can talk about it. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Exactly.